Hello, everyone. Hope everyone can hear me. Welcome, everybody, to My Camera, My Story, and Our Rights. This is a webinar on communicating on abortion care and family planning as healthcare. Very important issue, and we have quite a lineup for you today. So let me just start first with some housekeeping announcements. Please note that we will record this webinar. And we will also share the recording with all participants in a few days. The conversation that we will have with our guests today will be followed by question answers. Please be sure to post your questions to the speakers at any time during this session. If you have questions, please make sure you post it in the Q&A function here on Zoom and not on the chat. So now let's get started. We will start with a recorded message from WHO's Department Director for Sexual and Reproductive Health and Research Department, Dr. Pascal Alati.
Dear colleagues, warm greetings from the headquarters of the World Health Organization in Geneva. Global demographic projections suggest that by 2025, there will be about 2 billion women of reproductive age, defined by the United Nations Population Division as 15 to 49 years old. These are women we expect to have autonomy of their own bodies, with equal rights under the law and in policy and practice, with access to healthcare that is respectful and responsive, regardless of who they are, what they do, or where they're from. Hello, my name is Pascal Alati, and I'm the director of the World Health Organization's Department of Sexual and Reproductive Health and Research, which includes the Special Program for Research and Training in Sexual and Reproductive Health. We're the department in WHO that supports the generation of rigorous research and evidence towards the protection and realization of sexual and reproductive rights for all. The right to sexual and reproductive health is an integral part of the right to health, enshrined in Article 12 of the International Covenant on Economic, Social, and Cultural Rights. Achieving sexual and reproductive health and rights should be celebrated. The World Health Organization guidance is clear. Abortion care is health care, and health is a human right. At this year's commemoration of International Safe Abortion Day, we want to celebrate this right to safe, respective, and affordable abortion care to be accessible to all who need it, when they need it. We want to celebrate and destigmatize the right to health and safety and bodily autonomy and choice, spoken through women's own words and through their own images. We invite you to celebrate with us the right to health. Thank you.
Thank you, Pascal. So we will next move on to a country perspective, and to give us a country context, we have some of our WHO colleagues and colleagues from the Ministry of Health in Sierra Leone here. But let's first get started with Dr. Samira Vaidya Rajbhandari from WHO Nepal. Over to you, Dr. Rajbhandari.
Yeah, thank you. So good morning, good afternoon, and good evening, everyone. So on behalf of Nepal team, I would be presenting on the overview of sexual reproductive health and safe abortion services in Nepal. Next, please. So coming to the background, Nepal has committed at the international and national platforms to ensure that the sexual and reproductive health and rights to all the women. Nepal is committed to attaining the Sustainable Development Goal. And in Nepal, abortion was legalized in the year 2002. The government of Nepal has enshrined the reproductive right in the Constitution of Nepal in 2015, and Right to Safe Motherhood and Reproductive Health Act was enacted in the year 2018, and safe abortion service is also considered as the basic health service as per the Public Health Service Act 2018 and its subsequent regulation. Next slide, please. So this is just a snapshot of the few indicators related to the safe abortion service and family planning. Here we can see that only 41% of the women of reproductive age groups are aware that the abortion is legalized in Nepal, and over 62% of the unintended pregnancies end in abortion, and an estimated 58% of all abortions are unsafe, according to Guttmacher 2017. And only 19.2% of the health facilities offer abortion care services as per the Nepal Health Facility Survey 2021. Next, please. So this is also just a snapshot about the milestones on safe abortion services in Nepal. As we can see, mifepristone and misoprostol was registered by Department of Drug Administration in 2008, whereas in 2009, medical abortion was introduced. And as we can see in 2020, safe abortion and family planning services were also included in the basic health service package as mentioned in the Public Health Service Regulation. Next, please. So under the SRHR project, though we have achieved most of the activities, these are few of the progress that we have made so far. So WHO provided the secretarial support to the government of Nepal to form the steering committee and technical working committee at the federal level and also at the provincial level. And also WHO provided the direct support to the provincial health directorates in all the 7 provinces, as we have our SRHR officers at all the 7 provinces who are based at the provincial health directorates. And WHO also supported the government of Nepal to revise, finalize, endorse, and disseminate the safe abortion service program management guidelines. And emergency contraceptive pills programs implementation facility guideline was also developed and endorsed under the leadership of Department of Health Services. Likewise, under the leadership of NHICC, National SRHR Social Behavior Chain Communication Strategy was also finalized. WHO even supported the Ministry of Health and Population to strengthen the pre-service education of SRHR, including doctors, nurses, and midwives. And under the leadership of Department of Drug Administration, assessment of surveillance system of MA drugs and quality assessment of MA drugs was also conducted in the year 2019 and 2021. So with this, I would like to conclude my presentation. Thank you.
Thank you, Dr. Raj Bhandari. We now have a perspective from Pakistan, and it's a video recording by WHO Pakistan's Dr. Ellen Tom.
Life course cluster. I'll share with you the lessons learned through the SRHR initiative in Pakistan. Context, Pakistan has the largest population, it's 5th largest population in the world, and is faced by a high burden of maternal mortality at 186 per 100,000 live births. SRHR indicators in the country at a suboptimal level. You can see the abortion rate is 29 per 1,000 women of childbearing age. The total fertility rate is 3.6%, and met need of family planning is 17%. The high out-of-pocket spending for health, and also the human resource for health is below the requirement of the UHC threshold of 4.45. You can see on the graph, Pakistan is 1.41. I'll share with you what the initiative has contributed in terms of achievements. The initiative contributed to updating of the key SRHR-related guidelines and training packages, both pre-service and in-service, integrating the abortion module in the service availability and readiness assessment, implementing it in 12 districts, advocating for more brands of misoprostol and including it in the essential medicine list, establishing 6 telemedicine centers for SRH service delivery, and also piloting the OPT health insurance for key SRHR issues, targeting poor families using the capitation model. Currently, we are working closely with the government and partners to sustain the gains made through this initiative and continue the pace set by the government to achieve the sustainable development targets for Pakistan. Thank you.
And we're now going to get a perspective from Sierra Leone. It's our colleague from the Ministry of Health in Sierra Leone, Dr. Francis Moses, and this is also a recorded message.
My name is Dr. Francis Moses. I work with the Ministry of Health and Sanitation as the Program Manager for Reproductive Health and Family Planning. This presentation gives a brief overview of sexual and reproductive health and rights in Sierra Leone and the work that the ministry has been doing with support from the World Health Organization. Sierra Leone is a small country in West Africa with a population of about 7.5 million people. We have about 2,500 health workers to service this population. We have one of the highest maternal mortality rates in the world at 717 per 100,000 live births. Our high unmet need for family planning, high teenage pregnancy rates, and unsafe abortions are significant contributors to maternal mortality and morbidity. We have a restrictive legal environment for abortions with a law dating back to 1861. It was called the Offences Against the Person Act. Efforts to change the law have met with resistance from religious groups and some civil society organizations. Gender-based violence is also a big issue, with more than 61% of women of reproductive age having experienced gender-based violence at some point in their lives. However, most sexual and reproductive health services, including maternal health, post-abortion care, and family planning, are provided free of cost as part of our free healthcare initiative in all public facilities. Over the past 2 years, we have worked closely with the World Health Organization to integrate SRHR in our UHC roadmap. We are also working on a new safe motherhood bill that will improve access to SRHR services at all levels of the health system. We have developed policies and guidelines for provision of SRHR services, and we're rolling these out to providers across the country. In addition, we have worked on strengthening coordination, leadership, and management for SRHR at the Ministry of Health, and we're taking a health system strengthening approach to addressing gaps in SRHR services, including strengthening quality of medical education and expansion of access to SRHR commodities and supplies. As we work towards our goal of reducing maternal mortality to less than 300 per 100,000 live births by 2025, we also hope to achieve gender equity and equality, drastically reduce the number of women experiencing gender-based violence, and strengthen our health systems providing sexual and reproductive health services as we work towards achieving universal health coverage.
Thank you so much to our colleagues in the 3 countries for preparing these snapshots for you. What we really wanted from this, not to delay the discussion about the photographs and to hear from the photographers, which we're so excited to do, but just to make sure that as we talk about these images, that we're really grounding them in the evidence and the reality of our colleagues and the technical work that they do to advance sexual and reproductive health in their countries. So we really appreciate getting that information. I think what we'll do now is move on to the discussion with our photographers. We are very lucky to be joined by 2 of the 4 artists who took part in this project with us over the last year. Photographers, one from Nepal and one from Sierra Leone. We were due to be joined by a 3rd photographer who was working in Pakistan. Who was working in Pakistan. She is, as you can imagine, extremely busy covering the environmental destruction and the floods at the moment, and she wasn't able to join. She did wish that she could, and she has also, if you'll indulge us, also sent a video message. Perhaps we'll play that once more and then we'll move on to the live discussion. Carolyn, over to you.
Hi everyone, I'm Saina Bashir and I'm a documentary photographer based in Islamabad in Pakistan. I'm currently in the field documenting the devastation caused by the recent floods in Pakistan, which has left 33 million people displaced. I wish I could have attended today's important discussion about how to photograph sensitive topics such as safe abortion, especially in a country so conservative as Pakistan, where stories are rarely told through a female lens. This inspired me to be able to tell stories that were not only important to me, but were also highly underreported. Earlier this year, I had the opportunity to work with WHO documenting their SRH and safe abortion program in Pakistan. It was the first time I was working on this topic and was very interested in learning how women would react when they see me with a camera. Oftentimes, while documenting sensitive topics, I don't take out my cameras right away. I try to build rapport with them, spend time with them so that they get to know me as well. Another thing that really helps me is a focal person taking us inside these communities. It is oftentimes someone that they trust. They serve as champions in their own communities, and that was the case for me as well while I was photographing this project. In this photo, as you can see, a lady health worker was a champion in her own community, which helped me immensely to gain access and make women feel comfortable. Women's mobility in Pakistan is mostly dependent on a male in their household who accompanies them to go outside, even for hospital visits. The lady health worker over here pays home visits to women in her community and talks to them about their issues. In this photo, a woman recently had a child, and the lady health worker weighed both the mother and the child. She brought up the topic of contraception later on. Another thing I noticed was that she was giving her own example. She was telling the women that she herself has been on contraception for many years and that she has healthy children. I think these personal examples are very helpful. The biggest challenge while documenting sensitive topics is mostly access. As we all know, consent is very important. I usually take an assistant with me who gets the consent form signed after I have explained to my subjects why we are there and why it is important to tell their story. I hope this was helpful and you all are having an interesting and informative session. Thank you so much.
I keep wanting to say thank you to our video speakers, but it's actually because we've worked with them so closely over the last year, and we are really very grateful for the commitment and the personal perspective that they brought to this project. I am now really honored to invite to turn on their cameras two of our photographers who we have worked with through the photo agency Blink, which works with a network of photographers all around the world. I see Uma has her camera on, and Hikma, if you perhaps would also. Thank you so much. Okay, so as you know, we've prepared a few questions. Perhaps I could just ask you, first of all, Uma, let's talk about why you do what you do as a photographer. Tell us what drew you to photography, and perhaps what drew you to this project in particular.
Thank you, Sarah. Hi, everyone. I'm Uma Bistar from Nepal. I'm a documentary photographer. To talk about why, I am doing photography is I always inspired to tell the stories of women, and in my personal practice also, I'm working on the issue around the women and the stories from myself from the other women in my community. I also interested when I got the assignment for this project about SRHR, because this is the very important issue, and particularly in Nepal, it is very important. It is very demanded project. For the SRHR project, itself being in Nepali, and then got chance to work with the women from very closely. It was my I was lucky to work on this project.
I think we see on the screen 4 of the photos that we've put forward for discussion today. You know, maybe just to give a little bit of background on this project, the idea was to consider where some of the gaps often are in the way we communicate about sexual and reproductive health and rights. You know, we know that good photos can help bring situations to life. We also know that bad photos can really hinder the way that we want to advance discussion on these issues. They can show disrespectful power balances, they can emphasize stereotypes, they can be taken without appropriate consent. Uma, maybe you could talk to us a little bit about the photo on the bottom left, what the scenario that we're seeing here is, and how you went about telling this story with your camera.
In these photographs, the left, the yellow, the color yellow earrings is the Min Kumari Thapamagar. We went. There are the local focal person was with me to coordinate everything, and also people from the WHO Nepal. They were giving me company to make my work easier. And see, Min Kumari is with her mother-in-law. She took the medical abortion service 1 year ago, and that day the MSI lady was in the door-to-door service for her follow-up, what's happening after the abortion, and she did abortion because of her unplanned pregnancy with her support from her husband and from her mother-in-law. And for them, that is also for Min Kumari itself, she after having that service, she is also spreading this service to other community women. She discussed about this reproductive health rights, and also their health issues to other women. And then she also connect with the people from MSI staff, ask them to take the service from them. And also it's very it's very easier, and it's also comfortable for them to talk with MSI people, because it's they have to go to health post or hospital. It's also about their privacy thing. They are very comfortable with taking services from the MSI people. And when I every time I go for the photograph, I don't want at the beginning I just build our relationship with communication. I just talk with them, their everyday life, or to make comfortable in front of camera. I don't show the camera at the beginning. I just want them to know about me, and also about the issue I'm covering for. And then I ask for the consent, and if they agree. And some in case of the scenario in Nepal, most of in these days also, many women doesn't read, and for them I explain everything. During the assignment, my assistant was helping me to explain about the consent, and also what's there, and why we are covering why we are taking their picture, and why we are covering their stories. And we explain everything about where their photographs goes, and where it will be published, and they will get agree, and then I'll start photograph and I'll collect the stories.
So thank you. I think what I'm hearing from you is that one photograph is really just the tip of the iceberg of a huge amount of building trust, of communication, of preparation. I perhaps one other question I'd be very interested to hear from you being what difference you think it might have made that you were taking these photographs in your own country as well. I think sometimes with global projects there can be the sense that somebody has come in from the outside and is sort of parachuting into a space and wants images and stories which have real value for individuals and for organizations. And we should be really respectful and recognize that. I wonder, from your experience, if it made a difference, the fact that you were taking these photographs in a context that you were familiar with.
I think I know the language, I know every situation, I know the reality. It helps me like to understand the situation, understand the issues, and that helps me to go in the deeper way for the stories, the whole like global scenario we are talking about, and especially working in our own, like in my own community, in my own country. It is the most advantage point for me to uh, get the stories from like depth level, and that's also help in overall scenario in the I think, like as you said, people from outside, if they come and start like they photograph, it's, I think, the real thing, I mean the thing what we wanted, that doesn't come in depth level, I believe. And I also believe that because also as I'm a woman, and they are very comfortable to sharing their stories, like they share like everything, and they just share very private situation also, which I cannot share to others also. And that also helps me to make photographs of them. And I try to capture those little things in my photographs, what share, like from our communication, from our conversation I do with my subject, and the trust they give me. And also I also respect them to while I'm all the time, while I'm shooting, while I'm photographing, I always respect their privacy, I always respect their situation. And I think that's the advantage for me to be as a Nepali and work with the subject from my own community.
Thank you so much. I think I'll get greedy and ask too many questions, and I'd like to bring Hikma into the conversation now as well.
So
well, we might not be finished, but certainly I think let's have expand the conversation. Hello, Hikma. I'm going to have some very similar questions for you. I think we can see on screen on the bottom right is one of your photos. But before we get into that discussion, talk to me about your own experience with photography. What drew you to the field, and what drew you to this project in particular?
So for me, as a young girl, I've always wanted to make an impact in my community and the country as a whole. But it was very hard for me to find a particular niche. So when I knew that I was very passionate and interested in photography, I wanted my photography to be different compared to other photographers in my country. I didn't want my photography to base on beauty. I wanted to tell stories about women and their experience. And also being a public health student and having a project like this come up, I was very, very interested and very lucky to be part of it, because I know that young girls and women are very interested in knowing the availability of this information about their sexual and reproductive health and right. So it's something that is very powerful, and it's something that I feel so lucky to be part of. So yeah.
Thank you. Perhaps you could talk to me, or talk to all of us, a little bit about the photo that we see in front of us. What is the scenario that you captured, and how did you go about building the relationship to get this photo? I know from our colleagues, when we saw it, the eye contact of the woman in front she's looking at us, but really she will have been looking at you, is very powerful. And I think we'd love to know a little bit about how you went about the process.
So this was the second day of my shoot at the PCMTT, normally called here as Cottage. So when we went there with the other WHO personnel and my assistant. It was early in the morning actually. So the nurse lady is called Sister Jara too. We explained that we were from WHO, that very happy to be part of this. And during the time that we were engaging and explaining to her, asking for her consent and all of that, this lady came in and she came here to take a family planning called depot injection. And when I explained things to her at first, she was like, oh, I'm very shy, but when I took my time, I was really happy to be part of this. And for some reason, I was like, I'm a woman too, and I just really want you to trust me and all of that. And we talked for a while actually, and then we took this picture, and it just happened to be that I created like this kind of like eye contact and trust. It just really happened. I really don't know why. And as a female myself, I guess to experience this, because this is my actually first time to see something like this happening right in front of my eye. So I saw how smoothly it went, and how at the end of the day you have like the sister had to cancel her and all of that, and tell her everything was very amazing and all of that. So yeah.
Wow, thank you for really bringing us into that moment. And I think you raise a really important point about the healthcare that is behind these images as well, the services that are being provided, the evidence for why I believe this is the contraception injection that the woman is getting, and contraceptive choice, or is of course being such a huge part of sexual and reproductive health and rights. I wonder if you anticipated any particular challenges with a project like this, and how you, what sort of preparation work you did to overcome them. I know, as you said, that you're a public health student yourself, so you kind of have these double binoculars, which make you particularly kind of powerful for this kind of assignment. But what challenges did you anticipate, and how did you move around them?
So when it came to the consent form, like most people were like a bit, like as you know, like the illiteracy rate here is kind of like bit. So most people, you have to like take your time to go through and explain to them, oh, I'm taking your name because of this, because I'm putting your pictures out there. And also the issue when it comes about wearing masks and all of that. Oh, I don't want to wear a mask for too long. But then I have to take my time and explain. And the WHO personnel were very, very helpful with me as well, and also my assistant. And at the entrance of this particular hospital, there are like few securities there who like questions. The moment you pass them, you meet a lot of lovely nurses who are really there to take you through these processes, and they were really, really nice and very accommodating. The challenges were not that much for me in my own place, that I would say. It was just really successful, and I was hoping like, because when you're behind the camera, I just get carried away sometimes. I was like, oh, I wanted to take more photographs of people and all of that. But the fact that we were able to meet like few people that we could share their stories here today, it's amazing. So yeah.
Wow, thank you. Without putting, I think, either you or Uma on the spot, I wanted to just to raise to the audience that we do have a Q&A function on the webinar. Your questions are extremely welcome. I think we've anticipated some, and we'd love to hear what some of the others are. While we're waiting for that, I thought, Uma, Hikma, if you had any questions for each other as well, now, you could put them in the chat, or you could ask directly as well. I think, you both worked on the same project, but in very different scenarios. And I just wonder, photographer to photographer, whether you have any questions for each other.
So for me, there's like, in my country, there's only like few female photographers out there. and it's very hard for you to have like a project like this because it's a male dominated field and all of that. And I just wanted to ask Umar, like, how does she goes through these processes? Like, how does she have to work like really, really hard for her to be seen, or you just allowed your work to speak for yourself? And how did she come about having this project or hearing about it? Yeah.
Yeah, it's also the similar situation here in Nepal. It's the still photographic community is still male dominated. But like when I started photography like 10 years back, it was like very few female photographers. We can count it in our fingers. Now the female photographers, numbers of female photographers are increasing. And like, not talking about this project only, I also work on as a female photographer for like, I always, believe that also I like trust myself that I have to tell my own stories and the stories of the woman, because this is really important. And no any male photographer can speak our stories from the ground level. And like I think because of my own work, I got this assignment because I always work with the issues of women. Like there are so many issues uncountable, and like working with these issues is like very important for me, and also on my practice, because like the situation and also the scenario with photographic scenario and also with the subject itself, issue itself is something to cover, and it's very interesting for me. And yeah, it's still male dominated, but I'm trying to do my do something, like do my best for like tell the stories from my camera for the larger world.
Thank
And
you. Sorry.
yeah, I also like as you said, I think it's still there. And how is the, I mean, situation for you to cover such kind of story, like how the woman like you already share something, but how do you build the relationship with the women to work on such sensitive issue in your country? How they react with your camera? Like camera is something, whenever we go with our camera, people react differently. And how is your uh, position? How do you take the position to convince them, Hikma?
Perhaps I could just add, as you answer that, Hikma, we're seeing a lot of questions coming in about consent as well. So perhaps as part of your answer, you might address that dimension too.
So there's so WHO, like Blink and WHO came together and they put together like a consent form where you have to write your name and you have to like sign the date and all of that. So it's verbally and then it's written as well, because like you have to explain, because most people that I encounter couldn't like really read, so you have to like verbally explain to them in our local language and build that trust as well, and say this is what we're doing, and this is it's about health and all of that. And I feel like the fact that I as a female as well, I'm talking to another female, there is this like a level of trust where both of us can relate in certain things. and and the fact that someone was there who like people know, they're like yes, because you just can't like just be there and say, oh, I'm from WHO and I'm taking these pictures, and you don't just do that. So having someone where they could like trust, like a elder in the hospitals, like sisters and all of that, they were there, and then they made it very clear, and it was it was like very, I don't know how to say it, but yeah, this is a matter of like you actually taking your time and building a trust gradually for them to really understand. And most of them were very understanding and very happy to be part of this as well. Because it's about raising awareness and then making people know that things like this like really do happen, and it is safe and it is out there. You can acquire it and get it at any time possible. So yeah.
Thank you both so much. I think we will make sure that you have each other's contact when we finish the webinar,
Yeah,
so that you can stay
definitely.
in touch. But maybe
Definitely.
I'll pass back over to Vismita, my colleague, who will perhaps see if there's any other questions to moderate and take us home.
Thank you, Sarah. We have a lot of questions which kind of speak to and are asking about consent. Why did people want to be part of this project? How do you build trust as an outsider? So I think that both our photographers, Hikma and Uma, kind of spoke to that. But if you have anything to add to that, how do you build trust? And then, Sarah, I'll come to you about WHO's consent process. So Hikma and Uma, any tips on how to build trust when you're talking about such a sensitive issue, a very emotional issue? And you know, you both described being women photographers and some of the disadvantages that there are in the settings that you're working in, but clearly that was not a disadvantage when it comes to connecting with the women that you're photographing. But speak to us about building trust a little more.
Yeah, for this project, it was easier for us to, like, you know, there was the coordination from the WHO Nepal, and there are the local focal person who do all the you know, contact, and they collect the right person, they contact the right person to photograph. And also, like, being in the like in the field, they kind of they already agreed to, okay, we can speak for this project, and they kind of find the right person to photograph on this particular project. In general, whenever we are covering such kind of sensitive issues, we always you know, respect them, because respect is something to trust, like also build up the relationship to get the story and to also make the photographs with them. And like in my practice, I always give some space for them to, you know, breathe, because, you know, I cannot just tell them, okay, I'm covering this, I'm taking photographs for this thing, or for this, you know, for, like, for example, to say, like, for the WHO, you have to give me consent or something. We never go on that way. We just, like, as a human being, I always go with, like, you know, I always give the space for them to think. Whenever, like, if they don't want, I cannot force them. And some of the people also, I must say that, you know, in this project, there are one woman who, like, was doing, who was in the post-abortion care service, she was in hospital, and she gave consent easily because of, you know, what situation she has gone through. She wants to know other women about that situation, and she gave me the consent, and she gave me the permission to take her photographs very easily, because because of small mistake, she has gone through, like, so difficult situation. She was in the life death situation, and luckily, because of she arrived in the hospital on very time, that saved her life. And she wants to spread that, like, no one, like, you know, never cared about, you know, this is a small thing, like. And then she wants to aware other women also, and she gave me the permission, because of the building the relationship is very important in my practice.
Thank you. I'm just going to quickly go over the questions We have a question that being able to connect with your subjects of your pictures in their local language seems to create the rapport as well. And that's clearly so here. What advice would you give someone taking pictures in a community different from their own? If you've ever experienced that, would be interesting to hear about that. And then lots of people thanking you for sharing your experience. Do you have any recommendations for projects where where subjects themselves become photographers and co-researchers? That's from Angelica Campos. And do we have male photographers for this kind of topic? That's an interesting question. You know, trust and different cultural contexts play out differently. So let me actually come to you, Sarah. Speak to us about the top objectives of this project, and speak to us a little bit about the process of consent that WHO has.
Yeah, thanks, Vismita. I mean, I think the main goal of this project is what you see on the screen. It's positive representation of sexual and reproductive health and rights issues. And our aim was really to focus on those elements of SRH, which are often the most polarized or perhaps complicated or challenged. So here in this case, you know, recently WHO launched our abortion care guideline. These are guidelines that affect the lives of everyday people, but what does that look like, and how do we sort of humanize that? A piece of research that WHO recently commissioned is really stuck in my mind, that really, it said that often it's movements that are opposed to SRH that end up using humanizing language, that end up kind of manipulating. And actually, as Pascal said in her opening, there are 2 billion women who need these services, who deserve choice and rights and health. And I think we really wanted to show them, to take a human perspective on these critical issues. We certainly wanted also to strengthen the relationships with our country colleagues, our country offices and our regional offices as well. I can't stress enough how much teamwork and partnership was a part of this. It absolutely took a year as a project, so it's not something to be rushed. But ultimately that was the goal, and this conversation is ongoing, because I think we're learning as we go about how to improve the way that we communicate.
Thanks, Sarah. Give me a 30-second download on your consent process.
Consent. All right.
3 minutes before
I have some bullet points of really how we ran this over the year, and I can say that we proposed this project to our kind of technical teams. We selected an agency, as I mentioned at the top. Blink is an agency with a long-term agreement with WHO and a lot of experience with our consent processes, which are heavy. We engaged our regional offices, our country offices in discussion, approval. We discussed what consent form would be used. WHO has a standard one, which is kind of very comprehensive, but we also, of course, discussed what languages it should be used in, what to do in cases where people were not reading or writing, and how they would be fully informed. Photo subjects were identified by our partners, full transparency about what the project was about. The photographers, of course, were very well briefed on what the consent process would be, and spent the time, as you hear again and again, the time with their subjects to make sure that they understood what they were engaging with and why they might want to say, to share their stories. And I think that's a huge part of this. Abortion is often a stigmatized issue, but having an abortion is a part of healthcare, and it should be the right of people to share their stories. So consent forms for every photo that we have are signed, and I will say that the names of subjects in these photos have also been changed just to protect their identities further as well.
Thank you, Sarah. You just described the process of informed consent, where it's not just somebody asking someone to sign something, but if you can't read or write, or if the consent forms are not in the right language, explaining the context of how these photos will be used. It's very, very important, and WHO insists on that. So thanks for explaining that. Thank you, everyone. I'm going to come to Dr. Bela Ganatra for her closing remarks next. Over to you, Bela.
Thanks, Vismita. Thanks, Sarah. Thanks, Uma and Hikma. I think that was a very powerful session. For those of you who are familiar with sessions that we do on abortion, this certainly marks a first for us. where we move away from talking about guidelines, recommendations, and research into talking about the human beings that are the reason why we do the work we do. And it's very powerful to see that despite the very different health systems, legal and other contexts of the three countries in which the photographs were taken, we see the same patterns of human stories, of health workers and of the individuals seeking care, and the powerful positive way in which we can document this topic. Of course, it's inherently private, but we are often conditioned to not move behind our thinking that it is stigmatized and sensitive. But Uma, Hikma have shown us that it is indeed possible to move beyond that. We welcome you to see more of their photographs, which will be available online on a digital display on Safe Abortion Day. And for those of you who have the opportunity to physically come by WHO's office in Geneva, we will also be demonstrating these photographs for over a month in our premises as well. So please continue to engage with us and the photographers, tell your own stories, and let's make sure on this Safe Abortion Day that we are centering our work around the women, girls, and individuals whose lives we want to impact. Thank you.
Thank you, Bela, and thanks to everyone who participated and also the people who put this webinar together. If you are interested in more of these stories, please visit the IBP Network's webinars and website. They have a collection of these stories, and they're also organizing on September 29th another webinar which will celebrate the launch of the 5 new implementation stories that describe how global WHO abortion care guidelines are being applied across the different local contexts. The IBP network also hosts a community of practice on comprehensive abortion care. So you're all welcome to join that. I will say thank you once again to everyone and goodbye. And we hope to see you next time in our future webinars. Bye.